Menopause happens only in women, and it's when estrogen levels start to decrease and so you stop ovulating. So having those monthly cycles, if you have them monthly, that's when they start to fall off, decrease, and eventually will stop altogether. So it's a change in the reproductive hormones, primarily estrogen, and that's what causes the symptoms, as well as what eventually leads to cessation of ovulation. We consider things of early menopause definitely before the age of 40, and sometimes even in the early 40s. Perimenopause can kind of describe that lead into menopause, but not full-blown menopause yet. So you'll have some of the symptoms, but not all of them. So the heart and blood vessels actually have estrogen receptors on them. So estrogen does play a role in some of our cardiovascular phenomenon. And so when people have normal estrogen levels, estrogen is actually cardioprotective. There is a thought that estrogen keeps endothelial function active, keeps blood vessels healthy. It can also actually affect arrhythmias or abnormal heartbeats. So some patients will have earlier extra heartbeats just around the times of their cycle due to fluctuations in hormones. So we know that estrogen and sex hormones do play a role in cardiovascular health. So the primary kind of heart-related issue or heart-related symptom that people will feel during menopause does tend to actually be palpitations. So again, because of the change in estrogen and sex hormones and the role estrogen plays in the heart, palpitations can be something that are not infrequent and sometimes can be quite scary because they happen frequently or they're very fast. So that's kind of the primary one to think about. Menopause does affect the heart in other ways, in that LDL or bad cholesterol levels start to increase and HDL levels or good cholesterol start to decrease. So then you can get plaque buildup in arteries. And so while you may not necessarily have symptoms of that right away, it is something to be aware of and to make sure your levels are getting checked. Hot flashes, while not really necessarily a cardiac component, are definitely also a part of menopause that most women will experience. There is an increased risk of heart disease in women who go through menopause early because of, again, the cardioprotective effects of estrogen. And so it is one of the risk factors we think about that are gender specific. So of course, only women will have this, but it is something we ask about when we look and talk about risk factors, because all those things that we did just talk about, so the change in cholesterol, the change in endothelial function or the function of the vessels changes. And if that happens earlier for women, those risks just increase. So it is something to be aware of and to talk to your provider about if you have experienced early menopause or are going through it currently, as your risk for heart disease is greater. Hormone replacement therapy, or HRT, is something that you may have seen or read about or heard about in relationship to menopause. While it can be beneficial for women who experience significant symptoms, it does not necessarily protect against the heart-related concerns that we have touched on. So it is definitely something to talk to your OBGYN and primary care provider about, but note that it will not necessarily protect from the heart-related symptoms. For women experiencing any symptoms of menopause, especially any heart-related symptoms such as palpitations, depending on how severe they are and how symptomatic a person is, I would say the first person to touch base with is your primary care provider to make sure that it is related to menopause and not something else, as many things can cause palpitations, and then to consider doing a monitor that will tell us what it is, how frequently they're happening, and what our next best step is. If they're very severe, very significant, and someone is very symptomatic, then going to urgent care or the emergency department would be appropriate at that time. Alternatively, if you have a cardiologist, reaching out to your cardiologist is also a great option.